All right, let's discuss the difference between bacterial and viral pharyngitis. So, as a clinician, when a patient comes with a sore throat, so many people immediately think of prescribing antibiotics. However, as a good clinician, we should never prescribe antibiotics before identifying the cause, right? This is because most of the cases of pharyngitis are actually viral, and antibiotics do not work against viruses, right? And unnecessary antibiotic use can lead to antibiotic resistance, unwanted side effects, and increased healthcare cost, right? So our first step should be to determine whether the infection is bacterial or viral, right? Now let's discuss the differences. So as for the causative agent is concerned, so the causative agent of bacterial pharyngitis is Streptococcus pyogen, while that for viral is rhinovirus, adenovirus, influenza virus, coronavirus, Epstein-Barr virus, right? Then we will ask about this onset. So if it's sudden onset, then it's bacterial pharyngitis, and if it's gradual onset, then it's viral pharyngitis, right? We will check fever of the patient, and if the patient has high grade fever, then it's bacterial pharyngitis, while in viral pharyngitis the fever will be low or there might not be fever, right? Then coming the most important one, there is no cough in bacterial pharyngitis, while in viral pharyngitis there is cough, right? Then coming towards the uh, tonsil, so there will be white tonsil exudate in bacterial pharyngitis, while in viral pharyngitis, mild redness with no exudate is found, right? Lymph node will be tender in bacterial pharyngitis, while in viral pharyngitis, there will be no such case. There will be no runny nose in bacterial pharyngitis, while in viral, runny nose is present, right? Body aches will be there in viral pharyngitis, while in bacterial, there will be no body aches. Hoarseness is usually present in virus pharyngitis. So, whenever you evaluate a patient with a sore throat, so remember these simple clinical clues. If the patient has a sudden onset, high fever, white tonsillar exudate, tender interior cervical lymph nodes, and no cough or runny nose, so bacterial pharyngitis is more likely, and we should prescribe antibiotics, right? On the other hand, if the patient has a gradual onset, cough, runny nose, hoarseness, body aches, and only mild throat redness without exudate, viral pharyngitis is more likely diagnosed, right? So we will treat the patient accordingly. That is, we will do symptomatic treatment in this case.